elbow was getting worse and the shoulder was getting worse just because of the workload here at the shop.
Bill's a pretty classic patient. He's a hardworking guy, depends on his hands and his upper extremities for his livelihood. He had a condition that we call lateral epicondylitis, or commonly known as tennis elbow, in his elbow, and he had some rotator cuff degeneration and partial tears in his shoulder.
I'd go to pick something up and I'd almost want to drop it, like somebody stabbed a knife in my elbow. It was tough. I wasn't making money. I mean, I'm the owner of the shop. I work. I don't sit behind the desk and tell people what to do. I'm full hands-on owner-operator.
You draw blood off the patient, you centrifuge it at a very fast rate, and it separates out this platelet-rich layer, and that's what you inject into the patient. And what you're really trying to do is recreate kind of a natural process of healing, because platelets have a product in them called growth factors. And so these growth factors help with the natural healing process.
Hopefully better ways of treating injuries than the current state of things, where we're using medicines that could have side effects.
When Bill processed all that information along with his inability to take time away from a surgical procedure, it made sense to him to proceed with a PRP injection.
All of these therapies require this type of research, and we're still really on the early aspect of the curve to determine what is truly working, what's making a difference.
So our goal in furthering biologics is to not just use them on patients because we have them available, but is really to be able to learn about how they work, when they work, and in which patients they work.
No, could not do this before at all. Too much pain in the elbow, not 100%, but I'm close. I'm about 75%, which has been a huge increase from not being able to do anything. Couldn't lift, couldn't spray, severe pain all the time.